respect to these practices and these actions, action is required. It's why, having learned about it last night, we've appointed Mary Ellen Turpel-Lafont. It's why we need to continue to take action on these matters today to determine both the remedies required and the reconciliation required to go forward. Thank you very much, and I'm happy to take your questions.
Thank you, ladies and gentlemen. As a reminder, press *1 to queue for questions. There will be one question and one follow-up. The first question is from Richard Zussman of Global News. Please go ahead.
Minister, the phone line cut off. I don't know how much of your beginning, so I don't know if you provided these details, but I'm just curious if we know how long these incidents took place for, where they took place, how widespread this is, and whether any doctors or nurses that are involved have been suspended, fired, or put on leave.
Well, these issues came to my attention last night. So on the former points, I think the answer, on the latter points, the answer is no. But these issues came to my attention. They're serious allegations. They obviously need to be investigated so that we determine the extent of them. And that's what Mary Ellen Turpel-Lafont will do. But it also requires recommendations, remedies, and reconciliation going forward. And I'll be seeking, obviously, her recommendations and advice and others as to the next steps. I think, I don't know if you were, if you heard some of the details of what the allegations are. They involve a game being played, guessing the blood alcohol level of patients in the ER, in particular Indigenous patients, and the obvious effect of such games being played on patient care. And so it's of course important to determine the facts, but it's also important to work together to take action and to move forward.
Thank you, Richard. Do you have a follow-up?
Yeah, I'm really sorry, Minister, because we did miss the beginning. I just don't know what health authorities this involves, how long it's been happening, and how widespread it's been.
Well, that's why we need, as I say, these issues were brought to my attention last night. All of those facts have not been determined, but there is sufficient information to require this investigation. And that's why I've asked Mary Ellen Turpel-Lafont to work on to go through to establish the facts, and also for us to immediately engage in a process of engaging in remedies and reconciliation on these questions. Because should these practices be confirmed, they are unacceptable and racist.
Thank you. The next question is from Justine Hunter, Globe and Mail. Please go ahead.
Thanks, Minister. And like Richard, I didn't hear the first part, so I don't know if you've identified if this was one particular hospital or not. So if you could clarify that, that would be great. Also, I mean, there have been reports of systemic racism in Canadian health care for years, and I'm wondering if you regard this as a one-off situation, if this in fact happened, or whether you recognize a larger issue that needs to be addressed here.
There is absolutely a larger issue that needs to be addressed. That's why we're engaged together in a path that to pursue in practices in healthcare, cultural safety and humility. Absolutely there is. And I have, since becoming Minister of Health, regularly met with Indigenous communities, with communities around BC, and issues like this have been raised. I think these issues are, the particular issues are so significantly serious that they require an investigation by someone of Ms. Turpel-Lafont's stature and authority, and I think that's important. And we have to continue to do this work because it is beyond dispute that there is people have suffered in our province from systemic racism in many fields, and healthcare is one of those.
Okay, but we still
Thank you, Justine. Do you have a follow-up?
Oh,
yeah,
and I apologize, Justine. With respect, maybe what I'll just say is what I said at the beginning, because you were cut off. That last night I was made aware of serious allegations of racist and completely abhorrent practices in an emergency room or emergency rooms in BC. If confirmed, the conduct is beyond unacceptable. The allegation is that a game is being played to guess the blood alcohol level of patients in the emergency rooms, in particular with Indigenous people, and perhaps others. And if true, it's intolerable, unacceptable, and racist, and of course, affected profoundly patient care. So this requires, in my view, an immediate response. I found out about it last night. I was in touch with, obviously, with senior officials of the Ministry of Health. I contacted, and others, I contacted Mary-Ellen Turpel-Lafont and asked her to lead the investigation and of this issue. I think she has both the credibility and she has the credibility to do that, and will do an excellent job. And as well, we need to engage with the First Nations Health Council, with First Nations leadership on this question as well. I consider these allegations very serious. Of course, we have to assess the facts, and that requires an investigation to take place, but we also have to see action.
Thank you.
Thank you. The next question is from Camille Baines of Canadian Press. Your line is open. Please go ahead.
Good morning. I'd like to know how you were made aware of this game that was going on, by whom, and have you given Ms. Turpel-Lafont some kind of a timeline to prepare a report?
Well, Ms. Turpel-Lafont will be starting immediately, as in Monday, I believe, and obviously there are both immediate and longer-term steps that can be taken, but she has to assess the facts and take the time that she needs to assemble those and make recommendations. But obviously, I believe there's urgency here, and that's why we've acted in this way. With respect to who informed me of this, I was informed of this by the Deputy Minister of Health, Steve Brown.
How was he informed?
I'll find that out, but he was informed. He both received the information from the community and from within the system.
Thank you. The next question is from Marcella Bernardo, News 1130.
Minister, thank you for taking my question. Just regarding the timeline of this and how soon you hope to have answers, I know that you've already touched on this, but also what does it tell you that you even have to investigate something like this in 2020?
It tells us why we have so far to go, but it tells us that, and as if we needed to know that systemic racism has not just existed in our country, but exists in our country and has impacts in all walks of life. And this is the work we've been doing. It's why we've been doing this work together over the last number of years, and why we have to continue to do that work. I think there has been progress, but what this tells us is that there is a lot more work to do, and we have to continue to do it. So yes, it is beyond disappointing, but at the same time, we have to continue to make the progress we're making. We have to continue to work. We have to continue to do the work with communities and with leadership and with communities to respond to these issues. I believe that we will hear as a result of this, because this is what happens, other concerns, situations that reflect these same problems in our society. But we have to take these steps, and these are the steps we're taking. So we need to be specific, but we also need to continue the path that we're on to ensure that there's cultural safety in our healthcare system. It's absolutely essential.
Just a quick follow-up, if you could elaborate on why you're reluctant to say where this happened, which health region, was it in the Lower Mainland or was it further north?
I'm not reluctant. What I want to do is establish all the facts. There's sufficient, in my view, the allegations are sufficient to require an investigation. But that investigation will determine all the facts, and I think it's important to allow that to happen. But I want to say very clearly, that if substantiated, these practices are racist and unacceptable, and there is a path to go on that we need to go on together. And of course, I will be part of it. It's not just Mary-Ellen Turpel-Lafont and many other people. We need to involve the many leaders, both at the First Nations Health Council, the First Nations Health Authority, the Métis Authority, the all relevant authorities in BC have to be involved in this, and we have to be involved together to address these issues. This requires remedy, yes, and reconciliation as well.
Vaughn Palmer, Vancouver Sun.
Good day, Minister. You've referred several times to a game. Am I given to understand that this is some sort of computer or telephone app where people were effectively scoring how drunk somebody was? Is that your understanding from this?
I don't have that detail, Vaughn. The story, the game appears to be to guess the blood alcohol level, how that was done, and how the game was run will require more information. But the game involved guessing the blood alcohol level of patients, essentially in advance or during their treatment. And obviously, playing a game of that sort is beyond unacceptable.
Follow-up question. I realize it's early. What sort of mandate and powers will be given to Mary Ellen Turple-Lafond, and will you make those public at some point, please?
Yes, and she will have the authority and the power to investigate as she sees fit. And that, as you know, as you've seen in the past, that may require an expansion of legal authority at some point. For the moment, she will be determining facts and making recommendations.
Binder Sejan, CTV.
Hi, Minister. You said in previous discussions with Indigenous leaders that you had heard of issues like this. Can you expand on that?
I've heard of concerns. I'll just give you an example. In the last period, as you'll know, we've announced new hospital projects all over BC, and in each case, we've involved First Nations community, Indigenous communities around the construction of new hospitals. And without exception, I learn of how people have felt of the history of the existing buildings and how we have to move forward from that. And when I meet with First Nations leaders and Métis leaders and others, of course we hear stories and circumstances where people are not treated well in the healthcare system, where they're treated inappropriately in the healthcare system. These issues get raised, and we have processes to address those issues. And we're engaged together proactively to support cultural safety in the system, and give enormous credit to the First Nations Health Authority, the First Nations Health Council, to friendship centers, to the Métis National Council, to others who are involved in this process of reconciliation. And we simply have to continue and expand on that while we address the specific allegations being made here.
So it sounds like there's a different process for other types of issues, and this one you decided warranted an investigation. Did the Deputy Minister do some pre-investigation to find out how the allegations came about, and if there might be some
these issues came out through processes that are already existent to pursue these issues. So we have processes of cultural safety in the system now and engagement now that are led in almost all cases by both health authorities and First Nations leaders and Indigenous leaders. But in this case, this information came forward, and I think it was obviously unacceptable that this practice continue. And action was required, and that's the action we're taking today. I hope, it would be my hope, but I say this with all caution, that this will be a moment where we can continue and advance and speed up the work we're doing together on reconciliation. But it's also a moment that we have to recognize the situation that exists.
Leanne Young, CBC News.
Other ministers. So I guess, so it says either room or rooms? Do you know if this was multiple rooms at this point, emergency rooms? And have these healthcare workers been suspended in the meantime?
No, as I say, these issues came to my attention last night, and we're taking the steps we've taken to investigate, to determine the facts, and then to take action, to seek remedy in these cases, but also to continue to pursue reconciliation and advancement here. But that is what we're asking, and I'm asking Ms. Turpel-Lafond to do, is to seek the facts, to determine where they are, and to assist us in making recommendations as we go forward. As well, we need to work closely with the First Nations Health Council, with the Métis National Council, with the First Nations health authorities to continue to pursue both these issues and to ensure that there are remedies in these cases, and as well to ensure and improve cultural safety across the system.
Sorry, so Minister, does that mean that in the meantime, while this investigation is underway, that these doctors and these nurses who were allegedly practicing this game are still working right now? Is that what you're saying?
What we have to do is, as I say, the allegations came to our attention yesterday, to my attention yesterday evening, and we are right now finding the facts and pursuing the facts, and I think that's the right thing to do, because we need to operate on that basis. We need to also pursue reconciliation and address issues around racism in the healthcare system and advance those efforts. And as well, we need to see where we need to go forward in terms of remedies in these cases, and as well in terms of reconciliation. And that's what we're seeking. That's what I've asked Mary Ellen Turpel-Lafond to do.
Mary Griffin, Check News.
Oh, hi, Minister. I'm just wondering about your reluctance to even identify the health authority where these games were playing out in the ER room or rooms.
Because I think it's really important to determine the facts here, and that's what I've asked Mary Ellen Turpel-Lafond to do. And so it's not, and what we need to do then is to ensure that all of the facts then established are laid out for everyone to see, and that's an important part of this process. It's an important part of cultural safety. So those issues, once specifically determined, they will absolutely be provided to you.
And just as a follow-up, you had talked about how these games, so-called games, were compromising patient health. Could you just expand on that a bit?
I think what they represent and we've seen other cases, and we talked about how we pursue other cases earlier. We've routinely done that when cases of racism exist in the healthcare system, and they do from time to time. We pursue those. And pursue reconciliation and remedy in those cases as well. So I think it's important to do that in all cases, and we're going to be doing that in this case.
Moira Whiten, the Tyee.
Hi, good afternoon, Minister. This is an incident on the more overt side of systemic racism. How is your ministry going to tackle the more insidious forms and unconscious biases among healthcare professionals that do lead to poor patient outcomes?
I think by continuing the work, we've been doing this work together since before I became Minister of Health. The Ministry of Health, the First Nations Health Council, the First Nations Health Authority, Indigenous leaders, and others are on this path together of cultural safety. And there is a distance to travel, and a distance that we need to travel together. But that work is being done and continuing to be done now. And what this tells us is we have to not just continue that work, but expand that work across the system. And I can tell you about the training and all of the work that's been done, but today is not necessarily a day to do that. But obviously, we are in the process of trying to make systemic change, and those efforts have to be redoubled and tripled and quadrupled for whatever it takes.
And to follow up, given that these concerns came from within staff and the community, how confident are you that further incidents may arise, and how are people protected should they come forward?
Well, I think that's why we need to to both establish the facts and make recommendations, but also work together on the broader issues and as they affect people, not just in this case and how they may have affected people in these cases, but how they affect people every day in our healthcare system. We've got work to do, and when cases arise, we consistently take on that work. But I think that the circumstances of this case require both an establishment of fact and action will follow.
Lisa Cordasco, CHLY News.
Thank you, Minister. I just wanted to talk about the mandate and the deadline. Have you actually set a deadline for Mary Ellen Turpel-Lafond to report on this? And it seems like there are two aspects. One is the actual event itself, whether it did or didn't happen, and secondly, the broader issue by involving other First Nations health authorities and others. So, do you envision this by involving all these other groups to have this investigation be more than a month? It could be months, or do you expect it to be weeks?
Well, I think two things. I think what we need to do is advance our work together, first of all, and to keep engaging in that work and making change, and changing the dynamic, so that and that's why we've appointed in all of our health authority boards 2 Indigenous representatives to make change, and we just got to continue to do those sorts of things. But in terms of the specific investigation, I spoke to Mary Ellen Turpel-Lafond last night. She obviously has to assess the facts before and assess the circumstances, and then we'll work with Mr. Brown and others in our ministry to see what the time frame is. But in the meantime, we also have to take immediate action, because these facts and these events have a profound effect on how people will view the system, and we cannot wait to act together, and that those actions will also be required. So action is required to be immediate. We need to take the time to assess the facts, and then we need to follow on the recommendations. And you can expect the recommendations that Ms. Turpel-Lafond makes will be followed.
Lisa, do you have a follow-up?
Is there a specific deadline for Ms. Turpel-Lafond?
There isn't a specific deadline yet. Obviously, the sooner the better, but we also, in such an investigation, it's Ms. Turpel-Lafond is independent in determining that, and she will have to look at the facts and decide whether she needs to report in an interim way, then a final way, or what we need to do. It's my expectation, of course, that such a report would be made public.
Thank you very much, ladies and gentlemen. That's all we have time for today. Thank you for joining. Please disconnect.
Thank you.